Who has a tennis elbow. He had a cortisone injection for this in the past, and we're going to see whether he will get any benefit from acupuncture. We're not going to use a lot of needles, just about half a dozen, and see what is going to be the effect of them. So the first point we're going to stick a needle here is the large intestine 11, which is diagonally opposite of the biceps muscle, and it's called Qi in Chinese. And that should go approximately 10 to 15 millimeters into the muscle. And the second point is the large intestine 10, which is 2 tunes distally to large intestine 11. Arm of 3 miles is the name of it, so quite easy to find with the 3 tunes. So it's about there. Again, about the same length, the same depth, sorry, with the previous one. And that needle there is the Lang 5, Qi Z is the Chinese name of it, the Cupid March, which is, the location is directly radial to the biceps tendon, and we needle at the cubital crease there, and we needle between the biceps tendon and the brachioradialis into the brachialis, avoiding the cephalic vein, which is radial to that. The radial nerve is a lot deeper, so it's slightly more lateral to the point, so it's quite difficult to get it accidentally. It's a very classic acupuncture point. It's large intestine 4, He Gu, the joining of the valleys. It's done. It's placed on the radial side of the second metacarpal. When the thumb is abducted, you take the point where you have most of the muscle, the prominence of the muscle, and you needle directly there. And you go about 1 or 2 centimeters deep. Make sure you miss a vein there. Okay, you go. And this goes directly in the tender areas. The name Ashi comes from the expression of the Chinese when you hit the tender points. They were sort of jumping, Ashi! It's something like ouch in English, the equivalent. And that's how the name was given. Perfect. This is 24 hours after the single session of acupuncture with 6 needles we've done, and Andrew is going to tell us what sort of difference he had on his symptoms. Andrew?
Yeah, after the initial session I felt instantly it felt better, and given it 24 hours I would say I've got a 50% improvement in how it all feels. And the pain feels slightly different as well, peculiarly, but it does feel different and 50% better, but not gone, but I'm pleased so far.
Okay, hopefully with the second session we're going to get there. Thank you very much indeed. I appreciate your testimony on this. Thanks.